although I've seen some stupid ones before, but not from you guys. A court order is not specifically mentioned in the HIPAA statute, but if you get served with a qualified medical child support order, for example, where it orders you to add a child to the plan, and that's usually the issue. The qualified medical child support order is ordering you, the employer, to do something. It's not ordering the employee to do something. It's ordering you to cover his child. So yeah, technically that would be a HIPAA special enrollment period, although it's not specifically mentioned in the statute. I would treat it as such. The court is forcing you to open the door to that child or spouse, whatever it happens to be. Is there ever a time when a group who has less than 20 employees has to offer COBRA, or are there any states that require an employer to offer COBRA if they employ less than 20 employees? Paul again. Yeah, actually, the federal statute, COBRA statute, applies to groups of 20 or more. Now, that's full-time employees and what are called fractional employees. If you are kind of in there and you don't know whether, give me a call, because fractional employees can get a little weird. But it's not 20 or more on your group health plan. It is basically 20 bodies, including these part-time employees. So if you might only have 5 people on your group plan, but you have a total of 30 employees, then that odds are that employer is going to be subject to the federal COBRA law. So don't look to the number of people on your plan, look to bodies. Second part of the question was, do some states have their own COBRA laws for groups that are under 20? And the answer is, yeah, most of them do. California obviously is the biggie. They have what's called Cal COBRA. Texas has continuation coverage. I think there's like 27 states that have what most people call mini COBRAs. So for those small groups, because what they were looking at is, here COBRA applies to these groups of 20 or more, but then, well, what about all these little groups that are 2 to 19? There are way more employers in the 2 to 19 group than there are in the 20 over group. So, but if you left at that group that only had 10 employees and you had cancer in the old days, sorry, you're out of luck. But so what the states were looking at is those people were going on Medicaid and some other state program. So a lot of states passed their own, quote, mini COBRA laws, and most of those laws are administered by the insurance companies. For example, in California, as we said, Cal COBRA is administered by the insurance companies for those smaller groups. So you wouldn't have to send notices. So if you don't know whether or not you have to comply with the federal COBRA law, or if you don't know if your state has an individual mini COBRA law, why don't you call me either later today or tomorrow, or send me an email and I'll do some research, and we might have to talk on the phone to talk about your employee population, but we'll see how that goes. How likely is the ACA to be revoked? Good thinking. I don't know. I doubt it. I mean, I don't think that's a whole other question. But I know they've talked about it. But aren't there certain aspects that most of us really like about the Affordable Care Act? We don't like the fact that the premiums have gone up, but a lot of these changes have been around now for 3 and 4 years. The fact that you have to cover kids up to 26, we're used to that. They're not going to go back to the old rules, and I think a lot of employers would prefer we not go back to the old kid rules. Right? That they have to be principally dependent upon the employee for support. They have to be a full-time